I'm Brent, a consultant plastic surgeon. I trained at St Thomas's Hospital and Cambridge University, did junior jobs at Great Ormond Street, spent a long time in Glasgow in the plastic surgery department where we dealt with lots of low velocity injuries, a bash, things like that. So that was extremely good training. And then became a consultant here at the Queen Victoria Hospital, East Grinstead, where I ran the burns unit for over 10 years. Recently, though, I've been to America to see exactly how the aesthetic things, how cosmetic surgery is done, and I formed a great relationship with my colleague Joe Hunstad, who's written a fantastic book on abdominoplasties and body contouring. And he often used to come here to England and operate with me. I used to go and see him. And so I've had a really good expertise, particularly in body contouring. So now I've been practicing for over 20 years as a consultant, and I feel quite confident that I've seen most before and afters problems. And the key thing is, we can do an operation, but I do know how to get out of problems if they arise, and of course how to prevent them before they arise. Abdominoplasty is a great operation and I enjoy doing it. But the key thing about it is it's a big little op, meaning it's not deep inside you, but it's a large amount of skin undermining. So the first thing is safety. All our patients have got to be fit. And if you're over 60 or your BMI is high, you're heavy, you often get seen by our physician, Paul, who looks at you. He's a consultant and he does a heart monitoring, breathing tests, everything you can think of to make sure you're fit for the surgery. If you're not, we get you fit. And he, of course, looks after you during your stay. Secondly, physiotherapy. On the day of your op, you meet the physio. She will show you various movements and exercises to do before and afterwards to get you standing up straight. The anaesthetist. He's very important. Obviously, your life is in his hands. Our ones are very, very well trained and they do a lot of this work, so they make sure your post-operative thing is pain-free, of course. And we do this by putting local anaesthetic in at the very end of the operation. So for the first sort of 24 hours, there's no pain at all. You don't even need very much in the way of tablets. The hospital, that's very important. I only use proper hospitals with medical officers on call who are here all the time, nurses who know exactly what they're doing. And interestingly, I keep my patients in usually for 3 or 4 days because I want them to go home able to be able to manage for themselves, not needing any help. Of course, you can't do other jobs and run around too much. You will need help in the house, but not for you. You'll be fine. Before the operation, I like everyone to wash themselves with chlorhexidine. That's the same stuff we use in our hands as surgery because it kills all the bugs. And we have that for about 3 or 4 days beforehand. So you come to the operation absolutely clean, no infections post-operatively. We just don't want that. And this way, that really helps. So then we come to the operation. First of all, liposuction. Even if you're fairly slim, we do liposuction of the upper body, round the flanks here and into the hips. And the reason for this is, not only does it take any fat away, but it shrinks your skin down. So when I tighten up everything, the liposuction contracts everything. In the old days, if someone had a lot of skin to take off, we made a vertical cut as well as the one underneath. But now, since I've been doing the liposuction in the upper body, you don't need that so much. So there's the skin incision, which is a long one, goes from hip to hip, and another one around the tummy button. And after this operation, and during it, we undermine the skin right up to the xiphisternum, right up here, down to the pubis, so I can see the whole of your tummy wall. Then we look at the muscles, and virtually everybody, even if they haven't had babies, but who are heavy and have got lax skin, as we'll talk about later, they do require muscle tightening. And we use a stitch right from the top here all the way to the bottom. No meshes, and this is tightening the muscles. We actually sometimes call it a ventral hernia, like the 2 muscles that run down here, the rectus muscles, are parted, either because you've been overweight and you've lost weight, or because you've had lots of children, and they're tightened. Now, when you tighten them, it gives you back your waist. Then we then put local anaesthetic everywhere to make sure there's no pain. Then we pull the skin down, remove the excess, and stitch you up. Now, stitching up, that's important. We use a subcuticular stitch, so it's dissolvable. There are only a very few stitches to come out. We then put glue on, and that seals the wound. and it stops any infection getting in. But also, the glue stops the wound edges moving apart like microscopically, which can give you a bad scar. And then we put some flesh-coloured tape on to secure everything. So basically, you just have tape round your tummy button and from hip to hip, and that's all you need. And this stays on for about 3 weeks. You have a nice binder on afterwards to secure everything, and some foam to make everything comfortable. Now, in the hospital, you do have drains. And the reason for the drains is not only to remove blood, but it's also to suck your skin of your tummy wall back onto your abdomen so that it doesn't shift, so everything sticks back together. The other important thing during the operation is, of course, no bleeding, because that's so important. And so we have drains, but also we use our harmonic scalpel. And this is a wonderful knife that's ultrasound and ultrasonic, and it gently cuts and seals. So there's no bleeding during the surgery, and all the lymphatics, things that can give you sort of swelling, we call them seromas afterwards, are on the whole got rid of. What are the real advances recently? Well, the advances are the anaesthesia is much better. Your body is relaxed and you get over it very much quicker. The antibiotics are better, so you don't have post-operative infections are rare. But the key thing is our special knife, this harmonic scalpel. This ultrasound cutting machine is very low temperature, but it seals blood vessels and lymphatics. So it really has stopped our amount of times we had seromas. That means collections of fluid underneath the big skin flap. To prevent that, we have drains, as I've already said, to suck out everything. You also have stitches called quilting ones, which take your tummy skin, attach to your tummy wall. But the key thing is this special knife. I really use it for almost all my, well, you do use it for all my body contouring procedures. Post-operatively, we give you anticoagulants, and these are things to thin the blood so you don't get any complications like a deep vein thrombosis. We usually give you a catheter to make it comfortable for the first couple of days afterwards, so you don't have to run to the loo. And basically, over those days, you get better and better. When at last you go home, you just have to be gentle. And what we say is, it's 2 weeks gentle, 2 weeks not so gentle, and then the Olympics. So that's it. For the first 2 weeks, you can do anything, but don't jump around. Don't drive a car. You might be able to, but not too much. The other one is the threes. 3 days it feels tight. It's not painful, but it's tight. 3 weeks, you're bruised and puffy. And at 3 months, everything settles down. And obviously, we keep a keen eye on your scars too. We often put tape on the scars for up to 3 months because this tape again stops irritation and stops the edges moving, and again helps give the best scar possible. After the operation, interestingly, a lot of my patients said to me, my word, my stress incontinence is better, my backache is better, my dyspepsia, that means mild indigestion and dragging abdominal pains are better. And of course, this is all because we repaired the abdominal wall. And this is one of those after things that you don't think about, and a lot of people put it saying it's the menopause, but it's not. It's all to do with your tummy wall. So once you've got that back intact and firm, you're very much better. Patients do complain that they have to change their clothes, but they feel fantastic. Who are the best candidates? Well, the best candidates are anyone who's got real laxity of their tummy wall. If your tummy is hanging down, if you're bulging out here, that's too much skin and there's muscle weakness. So they're the sort of people who've had thin girls who've had lots of babies, and people who've undergone sort of weight loss. If you want to come and see me to discuss anything that you've heard about, I have free consultations. And this is because I know you know all about the operation. So it's not really in the consultation, do I need it? But it's much more, how is it for me? Where will this scar be on me? Am I suitable? I have their various pains. Am I too fat? It's things like that. Am I too thin? Am I too old? This is what we go through in a free consultation. If you decide to have the operation, then of course we have another consultation where you see myself and my nurse, and we go in intimate details of exactly what's going to happen to you. I find this works very well, and most of my patients do like to go ahead with the surgery if they are happy with the way I've described it and if they're suitable. So basically, you just have to phone my office here in Tunbridge Wells, 01892 740 044, to make that consultation. The other thing that's nice here at the Spire Hospital and others that I work in is that what you pay for is seeing me initially, then you see the nurse, and then you have your operation, and then a year's aftercare. I keep an eye on you for a year just to make sure everything's as it should be. We don't want dog ears, for instance, at the back. That's where darts, can occur. We want a nice scar. If things aren't quite right, they're good, but they're not quite right, we put them right. Perhaps 6 months down the line, but there's no extra charge. It's one fee for the job. And of course, after the year is up, we'll be your plastic surgeon for as long as you like for any other procedures. So, good luck.